So what exactly is mental illness? Well, this isn't an easy question to answer. The reality is that mental illness, mental disorder, has been defined in so many different ways over the centuries, and even today there are several different definitions. What they all seem to have in common is to say that mental illness is made up of problems with the way we think, the way we feel, and the way we behave. But when we've said that, we really haven't said very much. And there's a real problem with this definition, because we only really end up with diagnoses. And whilst diagnoses can be useful, they're not all that helpful in defining mental illness itself. Diagnoses are used either to predict outcome or to inform treatment. But in order for that to work, we still have to know what the problems are. And there are volumes and volumes written on different diagnoses and the interpretations that different people give to them. And that's one of the reasons why mental disorder is seen to be so complicated. In this course, we're going to use the ICD-10. Now that's a diagnostic manual. It looks at the different problems that people have, and it puts them together in groups of symptoms and uses those groups of symptoms to create diagnostic categories. It's the doctor's Bible, if you like. But there's still a problem with that, because for the most part there are no blood tests for mental disorders. You can't do an X-ray of the brain and see the problem. You can do CT scans for some of the dementias, but that's about it. The rest of it is to do with history, behaviour, interpretation of behaviour, and what we like to call clinical judgment. But a lot of recent research has actually shown that that in itself can be less than perfect. And there have been some interesting pieces of research involving actors going around getting diagnosed in different places with very different disorders, and disorders that have very different prognoses as well. One of the things that I think is perhaps most telling about mental disorder is the way that it tends to reflect society's norms. And as society's norms change, then so do our assumptions about what is or is not a disorder. But that isn't really terribly reliable, because it doesn't have much to do with illness. If it's simply that most people disagree with you, then psychiatry becomes little more than social control. And indeed a lot of people will tell you that's exactly what it is. Personally, I disagree. I think that we work with people who are genuinely distressed, and we genuinely look to find reasons to help them to be less distressed. And that's it. We don't force ourselves on people unless they are a risk to self or others. People come to us because they're depressed. If they are a risk, then, well, okay, we will use the Mental Health Act in order to work with them and treat them to prevent them from being a risk either to themselves or to others. And in that sense, psychiatry is social control. But that's not by any means the bulk of what we do. And it's certainly not the bulk of what happens in mental health social care, which I think is going to be the largest market for this series of videos. But I want you to look at the exercise on the bottom of the page. What is mental illness? The one that talks about homosexuality. Do the exercise, see what you think, and I'll see you in the next video.